This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The opinions expressed in the podcast are not those of Hearts Unite the Globe, but of the hosts and guests, and are intended to spark discussion about issues pertaining to congenital heart disease or bereavement.
Welcome to Medical Monday, a special Heart to Heart with Anna podcast for Heart Month, February 2022. I am Roslyn Rivera and the guest host of this special podcast. I am also a heart warrior and a pediatric cardiology nurse. On Medical Mondays, we will investigate different medical devices that have been created to improve the lives of people born with congenital heart defects. Today's topic is the Harmony pulmonary valve and the Alterra Pre-stent, and our guest is Dr. Daniel Levi. Dr. Levi is an interventional pediatric cardiologist and professor at the UCLA School of Medicine. He is a world leader in transcatheter pulmonary valve replacement and is well known for his clinical and translational research. Dr. Levi, can you please tell us more about the Harmony pulmonary valve and the Alterra Pre-stent?
Thanks so much for having me on, Anna and Rosalind. We've been doing pulmonary valve replacements in congenital heart disease patients at UCLA since 2010, and the Melody valve program started even earlier than that. The valves that we've been using to date are balloon expandable valves. So the Melody valve and the Sapien valve are valves that we put on balloons and we blow them up in the heart. Most patients that need pulmonary valve replacements in the congenital population are patients who've had usually tetralogy of Fallot repair, but some of them had repair of double outlet right ventricle or other things, but mostly patients with tetralogy of Fallot who have been surgically patched in their right ventricular outflow tracts need pulmonary valve replacements. And another very common group is patients who've had surgical or balloon pulmonary valvuloplasties to open up pulmonary valves that are stenotic. So these two big patient populations leave us with older patients who have really big, what we call right ventricular outflow tracts, meaning the connection from the right ventricle to the lungs is really big and too big for any of the balloon expandable valves. Simply put, all of these patients were getting surgery up until the past few years when we've now had access to the Harmony valve and Alterra Pre-stent as part of FDA mandated IDE clinical trials. Both these valves are now FDA approved, so we can now offer a much greater percentage of our congenital patients minimally invasive pulmonary valve replacements because of these self-expanding devices. When we start talking about pulmonary valve replacements, there's really three different landing zones in patients with congenital heart disease. Some patients have bioprosthetic valves that a surgeon's already put in them, and it's pretty straightforward to put a balloon expandable valve like a Melody valve from Medtronic or a Sapien valve from Edwards inside those valves. There are also right ventricular to pulmonary artery conduits that surgeons put in. For those conduits, they sometimes have valves in them, often become dysfunctional, and those are also usually treated with balloon expandable valves, such as the Melody valve or the Sapien valve. Most patients that need a pulmonary valve replacement either have a right ventricular outflow tract that has been ballooned and is still kind of the native tissue there, or they have a right ventricular outflow tract that's been patched open as part of a tetralogy of Fallot repair. These are the patients that the Harmony valve and Alterra Pre-stent treat. Both the Harmony valve and the Alterra Pre-stent are nitinol-based devices that go in through a small tube called a catheter, and they kind of pop open as we sort of unsheath them or push them out of the catheter into the right ventricular outflow tract. They both have sort of controlled release mechanisms. So as we're deploying them, if we don't like where they are, we have a way to sort of recapture them and start over again. The Harmony valve is sort of an hourglass shaped, self-expanding device that comes with a valve in it. The Alterra Pre-stent has a similar shape, but it does not have a valve in it. So once we put the Alterra in, then we, in a separate stage of the procedure, place a Sapien valve within the Alterra Pre-stent, which is why we call the Alterra a pre-stent, not a valve. The Alterra Pre-stent just got FDA approved, and we've only done one commercial case. The Harmony valve was FDA approved last year, and I think we've done 200 or 300 commercial cases of that. So these valves are really important to this patient population because they enable hopefully many hundreds or even thousands of congenital heart patients to avoid open heart surgeries every year.
Are all of these devices done in the cath lab or in the operating room?
Thanks so much, Roslyn. I should have really clarified that. All the devices are done in the cath lab. So both the Harmony valve and the Alterra Pre-stent are placed under X-ray guidance in the cath lab, usually through a tiny little incision and needle stick into the femoral vein. We don't really use any sewing or cutting. We don't have to open up the heart. We don't have to use cardiopulmonary bypass, and the recovery is a lot quicker. So again, the advantage of this is it's a non-surgical, minimally invasive pulmonary valve replacement in the cath lab under X-ray guidance, rather than a median sternotomy, open heart surgery with cardiopulmonary bypass.
That's great, minimally invasive to help our patients recover quickly. Does that mean that most of these patients will go home the same day after having these devices inserted?
There's been a number of patients we probably could have sent home the same day, but because we're using such a big sheath to deliver the valves in the femoral veins, the standard of care is to watch the patients in the hospital overnight, make sure they do well, make sure their valves are functioning well before we send them home, almost always the next morning. There are a few patients that have had to stay longer than that, but the vast majority of them have gone home the next morning.
Thank you, Dr. Levi.
It's incredible. No question about it. Okay, guys, I got to get back to work, but thanks for including me in this. I hope I did a good job, Anna.
Of course you did. You did a great job, Dr. Levi. Thank you so much for explaining to us about these two devices. I have never even heard of the Alterra Pre-stent before. I want to thank Roslyn Rivera for being the guest host for today's episode, and Dr. Danielle Levi for teaching us about the Harmony Transcatheter Pulmonary Valve and the Alterra Pre-stent. This is the first in a series of Medical Monday podcasts, and I hope you'll tune in tomorrow for our regular Heart to Heart with Anna episode featuring a very inspiring heart warrior named Liz Zangara, and she will be teaching us about how she has created a healing environment for herself and others. That's it for this episode of Heart to Heart with Anna. Thanks for listening today, my friends, and remember, you are not alone.
Thank you again for joining us this week. We hope you have become inspired and empowered to become an advocate for the congenital heart community. Heart to Heart with Anna with your host, Anna Jaworski, can be heard at any time wherever you get your podcasts. A new episode is released every Tuesday from noon Eastern Time.